Okay, so when it comes up, it doesn't have my packages in it, but you'll see Simple File Manager. On the left-hand side, I'll use the mouse, I think, so I can operate it for you. On the left-hand side, you'll see Content Packages. If you click that, it will have virtual patients or set content that they have. If you go on this side, it enables you to do three things. One, you can put your own private material there to use in teaching. You might want to record or interview a patient to use in your lectures, etc., with, I guess, with their permission. And a lot of our students now and our teachers are going around and they are recording, they're building up a database of actually interviewing real patients, going through the process of real diagnoses, treatments, etc., with their permission, and putting it into a base where either the lecturer will use it for their own personal use, or they'll put it in a bank here for the school or university use, or they'll open up to the public. And the idea, of course, of this whole move, I guess, is to, again, share content, make global education the key thing. Share material, share resources, share your passions. If we go to the public folder, we get some examples of conditions that they've put up. Skin cancers, a number of different issues with patients. And on the right-hand side, you have the ability to view each of those conditions. And you'll notice that a lot of these have been created this year because it's a very new, novel type suppository that they're building up. I'm not sure if this is going to work because of the download time and that, but let's try Mr. Bell. When we open up Mr. Bell, we have here a whole series of what processes are involved with treating Mr. Bell's particular condition. And it will be different for various patients and various conditions. In some cases, they're virtual patients, in some cases, they're real patients. So I'm just waiting for the video clip to load. If it will, it may not. Oh, we haven't got the sound projector. Doesn't seem to be any sound connected through this computer, so it may not even load it up anyway. It doesn't seem. It may not even download the video because of the restriction on the download speed and that sort of. But you don't need to even listen to what's going on. You can tell what's going on. But these are situations where a particular clinician might have a series of their conditions recorded. It could be actors, it could be real clinicians, it doesn't matter. Obviously the best thing would be to have the real clinician and you be the person in the video. It doesn't take much effort or time to have someone video you in a real life situation and load it up onto a platform like this. What's happening here is that a member of the nursing staff has phoned up the clinician who's in his office and said that Mr. Bell is showing signs of some sort of confusion. And she's asking, or he's asking her, what sort of what needs to be done. So he then has to go and have a look at the particular patient, Mr. Bell. And then there's a few things here, for instance. There's a quiz. You can put quizzes in. Again, it doesn't show the whole. I don't want to expand the whole thing, otherwise I'll lose it. But often there is a scenario here and a question down there, and then a response the student can put in, and then they view the answers to give them immediate feedback. Things that might help contribute to Mr. Bell's confusion. There's another video where the clinician might interview other people in the family to get feedback. And then you go further and you can look at the history of the person. And they access notes. You can go into investigations. That was my favourite movie. Students go through this procedure where they get all the information and they're asked, and I can't do it because it's not loading up properly, but you get the idea. They have a whole host of investigations, diagnoses, management. There are questions that unfortunately won't load up, where they then need in the end to make some specific diagnosis. You can see this particular video clip is offered from the University of Southampton. Unfortunately, we can't hear the sound, but well, that's gives you some idea of what the resource can give you. Another one is to, if we go back, if we open up the virtual manager, I actually do recommend you email these people and just ask for access, just to have a look at it, because you'll see it on your own computers much better than it seems we can project here. Their aim, I think, is to add more material on surgery as well as dental treatments and dental diagnoses, and basically all it means is in your everyday teaching, going around in your clinical rounds and also with your students, and videotaping the whole procedure from the start to the finish, and then loading it up in a platform like this where students can access all the material rather than needing them to be physically present at the hospital. They can review material any place, any time to make their learning a lot more effective.